Hi, this is David Reina again, chiropractor with the Florida Orthopaedic Institute, and I'd like to talk with you all today about a condition called mechanical lower back pain. And if you've ever been out in the yard or just doing activities and bent over and all of a sudden you couldn't come up, that's what's called mechanical lower back pain. So why does this occur? Let's come in here and I'll tell you why.
Good afternoon, physical therapy. This is Hillary. How can I help you?
This is an MRI of the lumbar spine or the lower back. These square things are vertebrae, and in between you have a disc, which usually is white in this sequence, and notice how it's dark. What ends up happening is this disc can lose some of its water content, which is called disc degeneration, and as it degenerates, the weight of the body transfers back into the joint, and when the joint becomes overloaded, you see all this whiteness here? That should actually be dark. These are the muscles that help to support the lumbar spine. When they become white or they become weaker, then the lumbar spine becomes more unstable. As you do your activities of daily living, those muscles can fatigue, and as they fatigue and you perform an activity where you bend forward about 30 degrees, once they get tired and they let go and the joint slips, a reaction occurs and a reflex response occurs that basically shuts you down. So what are we going to do if we have mechanical lower back pain? Let me get my wonderful assistant Leah again to show you. Leah, lay on your back.
Oh my God.
So mechanical lower back pain is not an inflammatory condition. So taking Tylenol, taking anti-inflammatory medications is not really going to take a lot of the pain away. Interestingly enough, what helps mechanical lower back pain is sometimes the things that can hurt it. What helps it is little bits of movement as you're breathing. So if you find yourself where you're having mechanical lower back pain, crawling on the floor, having to get into bed, this is what you do. Bend your knees. So we're gonna actually bend the knees in this position, and you're gonna blow out, let your breath out, Leah, and then let your legs fall to the side. So what's gonna happen is as your legs fall to the side, your lower back's gonna go into a spasm. Just stop when it goes into a spasm, breathe it out, relax, breathe out again, and let it go. It's gonna spasm again, and then relax it, and then breathe out, and let it go. Progressively, what you're going to do is find that range of motion where your muscles relax and reset, which allow you to have more proper movement. In order to get up from this position, this is what you do, and it's very important. I'm going to have you breathe out and lay on your side. Good. Stay there. So notice, each time I have the patient exert themselves, I have them breathe out. When you breathe out, if you're having any spinal condition, for example, a disc herniation, when you breathe out, you're going to drop the pressure within your spinal canal. Number two, when you breathe out, you're going to contract those little muscles. Remember the ones I showed you on the MRI? You're going to contract those muscles and the lower abdominal muscles to support your torso. So we're going to get up now. You bring your legs over the bed and breathe out and push. Hold this position for approximately 5 seconds. Let your body weight settle into the joint. Let the reflex I was talking about engage. Scoot out to the edge of the chair. Look up. Breathe out. And now stand. And then hold this position for a quick count to 5. 1, 2, 3, 4, 5. Then you can move. So as you do this routine, if you're having mechanical lower back pain, you're going to be able to control those little receptors within the joint and the reflexes, so that way you can progressively improve. If you've ever had mechanical back pain, the first 2 or 3 days are very severe as far as your limitation of movement. After you're able to move and walk around, you'll have about a 7 to 10 day residual period, which I call fragile period, where you can walk and move around. However, you want to limit your ranges of motion. So the things to remember with mechanical lower back pain, when you're in a fatigue state, for example, you've been very active throughout the entire day and you have that one more thing to do, you want to leave that thing alone, because that's the time when you're going to have mechanical back pain and you're going to fatigue your back. So this is David Reina again, and Leah. Stay happy, stay safe, Tampa.